So we're in the Western Fair Agriplex. Part of the facility we've converted over to what we will need to use or could need to use as a field hospital, as an extension of the London Health Sciences Centre. So our plan really is to create as much capacity as possible within the London Health Sciences Centre so that we can treat patients who have COVID. Should the need arise and should our capacity be exhausted both at LHSC and St. Joe's and other regional hospitals like Strathroy, then we would open this facility and that we would have patients who are who aren't critically ill but who are on the way to recovery or palliation come here and complete their care journey. So we've built the facility fairly quickly within the last week, obviously in a temporary type of fashion. In the next week to 10 days, we'll be fitting it out with equipment and other things and developing our staffing models as well too. And as I said before, the main thing that we consider a success for this is that we build it, but that we never have to use it. But that's not going to be dependent on us. That's going to be dependent on the virus and how our community responds by social distancing and isolation. Right now we've developed about 144 bedded capacity here. They're all in sort of 18 bed pods, so that's an efficient way of delivering care should we need to. We have the ability and the space and obviously now the know-how to expand double in this particular room and then over to the showroom in the other part of the Agriplex. So theoretically we could get up to about 450 beds should the need arise, but we think at least at this point in time this 144 bed piece will be a good start and will give us a good head start should we actually exceed capacity at our hospital. A number of our physicians have worked or are working in the military either as reservist or active duty field surgeons. We have a number of administrative leaders, nurses by background who are part of the Reserve Medical Corps here for the Department of National Defense. And so we're drawing on their expertise. As well, the architecture firm that we work with and our head of facilities, who's an architect, has information and advice that they've been able to get from field hospitals and set up in the United States. So we're trying to put all of that, both facility knowledge together and how to design this and what's the most efficient and effective, plus some of the boots on the ground experience, so to speak, from people who have lived that experience in other ways. We know that in our area, I believe Owen Sound is looking at standing up a smaller version of a field hospital as well too. We've seen media reports of Burlington developing one and building that out as well too. Not familiar with what the rest of the province is doing, but I know it's a topic of conversation. We're really trying to take a look at the overall capacity of the system, and should the modeling may suggest that we need more than we have now, and that's why we're building this facility out should we need it. Right now, today, we're doing good. I mean, we've got the availability of 300 beds that aren't occupied right now, so we could certainly surge through those. We have, probably a couple of dozen COVID positive patients, probably about 8 in our intensive care unit, but we know that can change quickly. We know other hospitals around our region, into the Kitchener-Waterloo area and so forth, their ICU capacity is really starting to strain now. So it can change really quickly, and only the virus knows how it's going to change. So right now, we're stable. But again, they could change quickly. Our staff are tremendously resilient. I don't think anybody's actually seen anything like this before. But that said, even though they're resilient, it is very stressful. We have people who obviously their spouses have been laid off and have concerns around cash. We have obviously personal safety and security concerns. We've been in the media with struggling to try to get the right amount of personal protective equipment, which we've made great progress on in the last week, really good progress on. But that said, people are concerned. They're concerned for their loved ones who might be at home and elderly and who have problems with their own health and will they get COVID and so forth. So I think our staff are holding up as best as possible. You have to realize that every day there's a new directive comes out, there's a change in process for all of our staff. We have about 10,000 staff who work in our hospital, another 1,000 or 2,000 doctors, and then some students as well too. So it's a huge enterprise to try to change. So it's a very confusing environment sometimes, a very unstable and uncertain environment. But that said, our teams really work well together, and I think given the consideration, they're holding it pretty well. The last thing I'd say is, well, we've built this. I hope we never have to use it. But again, we're not able to control that as a hospital. The virus will have a say in that, but also the response of our community. So the responses to the emergency measures that the province have put out around staying at home, social distancing and so forth, that's going to tell whether we are successful in not opening this. And for me, success is actually building this but not opening this.